Majority of our trauma is going to be seen in the road. We're going to see a lot of soft tissue injuries. Now, it's quite easy to just list on your chart, multiple soft tissue injuries, and not write down your decap ETLS or mention the type of lacerations. It's going to be up to you, but somewhere in your chart you need to document where these injuries are, the size, the length, the depth, the shape, the type of tissue that has been injured, to determine how much of damage was done. Now, we look at superficial being mostly just a slight epidermis with some superficial capillary oozing, capillary bleeding. And then when we get deeper, it's more extensive into the dermal areas and further down. It can even go down to the bone. Think about the soft tissue injuries, although they may look minor and superficial, are high-risk populations, pediatrics, geriatric, and special considerations may put them at more of a risk with underlying damage. So what may look superficial on the surface may be quite significant internally. For example, patients that are alcoholics or those that are on blood thinners. So as we go through the rest of this chapter, we're looking at preventing these type of soft tissue injuries. We should understand that there are also protocols that we need to take as far as PPE. OSHA requires us to have these safety programs, and these safety programs to mitigate injuries. First aid, CPR, AED. They're also supposed to provide at the employer's expense some type of PPE, biohazard equipment, hand washing facilities. These are all very important. We should also, depending on your the employment or depending on the environment that you're going to, they may increase the type of protection and training that their staff requires. So think about the facility or location that you are responding to. So just a quick review of the anatomy. As we go into soft tissue injuries, we have the skin that contains the epidermis. Epidermis is that scale-like top layer that we germinate the layers at the base. These layers slowly migrate towards the superficial top layer. The stratum cornicum is the hard layer, and that kind of sloughs off daily. Below the epidermis is the dermis. We have glands, hair follicles, collagen. We also have some first-line defense, mast cells and neutrophils. Below that, we have the subcutaneous, and we have fascia. Fascia is the stuff that covers over the muscle. It's a thin lining that covers over the muscle, potential area where bleeding can result and compress the muscles and blood vessels. Besides the soft tissue, we look at joints and extremities of those bones. So we have joints. These joints have articular tissue. These are our ligaments, and then attachments to the muscles. We have tendons. In between this joint space and the cartilage or auricular tissues, we have fluid in between those. As far as the musculoskeletal system goes, these can be deranged, displaced, separated, or disjointed. What happens when we end up injuring these areas? Well, usually you have a laceration. Within the first few minutes, we start developing what's called a platelet plug. Platelets clog that area. They call other components of the clotting cascade to aid with this, and they stop the minor bleeding right there at that superficial area. A few hours later, we start to develop a fiber mesh. This fiber mesh will continue to cause the tissue to continue to grow below it. Prior to that, we also have some vasoconstriction, histamine relief, capillary permeability to allow just blood flow to get into that area. Over a few days below that area that was injured, we have new growth coming over. We have granulation tissue, epithelial cells start to grow in a few days, and these start to close over that wound area. About 2 weeks later, we have the skin that's forming new cartilage. Collagen fibers, and collagen formation, making the skin more pliable and durable. Now, there may be interruptions in wound healing. That may be because of an area with poor blood flow, or a person may be a diabetic having decreased blood flow to that area. It could be over an area of extension and flexion, like the joint spaces of the hand, web spaces of the fingers, around the knees and the lower extremities. They could have significant comorbidities, poor cardiac output, edema in the lower extremities. It may be immune compromised either because of the diabetes or advanced age, or it may be on steroids, NSAIDs, anticoagulants, just malnourished, alcoholic, immunomodulators. A lot of different things will determine the healing process. Now, if they're not able to surgically repair and suture that site immediately, if the wound is grossly contaminated, or a wound is something to a degree where it cannot be sutured because of the injury time that they didn't get into the hospital for it to be sutured together, then it'll have to be closed by secondary intention. And this is where it heals from inside through the top layer. We look at cellular response and clot. Cellular response causes some angiogenesis. The epithelial cells grow granulation tissue. Below that continues growing up towards the opening until the epithelial growth gets to the top, and then we have this scar formation. Higher risk wounds. Human bites have a lot of bacterial, highly susceptible for infection. Dog bites, a lot more tissue damage, lots more tearing with the type of bites, tearing of the injury, tearing of the soft tissue, and compression because of the forceful nature of the bite can cause fracturing. And we may consider rabies, but the bite itself is not as infectious as a bacterial concern as it is the human bite. Cat bites, they have smaller teeth, less pressure in their jaw, but they have deep type of bites into the soft tissue. It's difficult to irrigate, harder to clean. Sometimes the teeth fracture and they left embedded in the skin. This leads to secondary types of infection. Other things are foreign bodies, such as coral. We see a lot of coral or sand in injuries at the beach. And if organic matter gets in, it's hard to get out. When organic matter is hard to get out, it's noticed as foreign. And remember that the immune system, when anything is recognized as foreign, it develops this robust immune response and causes a lot of swelling, a lot of redness, warmth to that area, pain. And so we need to get that cleared. If not, that area will get very infected and causes cellulitis. Now, potentially, there are some guys and some patients that are more prone to abnormal scarring with healing, hypertrophic tissue that develops over the injured site. It's just called keloid or scarring, hypertrophic scarring. Other soft tissue injuries are contusions. They are just the ecchymotic area. The tissue is not splayed open or lacerated. And we do have some microcapillary blood vessels that are hemorrhaging internally, which is causing that discoloration and swelling. The next is where we have more veins and larger blood vessels that are are injured during that blunt type of trauma. This causes more of a golf ball type deformity under the skin. This is our hematoma. We have significant enough blood loss to cause that deformation with the skin. Decreased clotting goes on, and if we worry about underlying organs potentially, if it's over an area. Now we look at the musculoskeletal joint spaces, sprains, strains, dislocations, and fractures. In the pre-hospital setting, it's going to be hard for us to determine as a result of the injuries. Number one, there's pain. Two, deformity may or may not be present. Three, they have discoloration and swelling. Number four. So it makes it all very hard and difficult to determine whether or not the underlying bone or joint space is fractured or dislocated. So we treat them all the same: sprain, strain, dislocation, or fracture. We'll go ahead and splint the injured site, immobilizing the joint above and below that potential injured area. And we never secure our ties over the joint space. So ligamental damage is a sprain, tendon damage is our muscle strain, and then when that joint space is deranged or separated, subluxed, or actually dislocated, we look at the joint being involved, or potentially even the bone itself causing a fracture.